Movement disorders is a group of disorders of the brain where we see persons with movements that are excessive, more than what is expected, or it could be the other way. It's less movements than what is expected. And tremor is the most common form of the movement disorder. We do have Parkinson disease, Huntington's disease, dystonia, tics, Tourette's, hemifacial spasms. These are all some form of abnormal movements that we see, but they're all different in terms of how they present. We take a multidisciplinary approach to treat patients with these abnormal movements. We have a team working on, there is a movement disorder neurosurgeon, there is a neuropsychologist who is dedicated to movement disorders. We have a physical therapist, occupational therapists, and speech therapists who are all trained with the Big and Loud LSVT programs, which is a great option, which is a great treatment options available for children with Parkinson disease. We do have a psychiatrist, it's a movement disorder psychiatrist. These are all part of the team, so when a patient comes in, he has the chance to meet all of this person. Parkinson disease is a disorder of the brain where there is a loss of cells in the brain that produce a chemical called dopamine. So the less dopamine in the brain translates to symptoms. And patients have typically tremor. They have slowness in movements. We call it as bradykinesia. There is also stiffness in movements. We call it as rigidity. People start to have trouble with walking, balance issues. These are all the initial manifestations where they have more of the tremor or stiffness and slowness. As the disease advances, they have trouble in the way they think. We call it as dementias. There are a lot of treatment options available at this time for treatment of Parkinson's disease. Physical therapy, occupational therapy, and speech therapy. Great treatment options. Deep brain stimulation, we call it as DBS, is a great surgical option available.
Deep brain stimulation is a procedure where we're putting electrodes into the brain and we're trying to change the abnormal circuitry that's there to change the abnormal movement that the patient has. We determine where the electrodes are placed based on the pathology that is present. So for example, a patient with Parkinson's disease will have a different target than a patient that has essential tremor. A patient that has dystonia may have a separate target, completely separate from Parkinson's disease. So one, it depends on the disease process that is there. And in addition, sometimes we have secondary targets. The target that we use primarily for dystonia can be a secondary target for Parkinson's disease, depending on the symptoms that are present.
What DBS does is what the medications do when they're working great without the side effects. The best part of what I do is looking at a patient, trying to figure out what exactly they have, to keep their symptoms as minimal as possible, and to give them the ability to do whatever they want to do in their everyday life.